So this webinar is brought to you by the New Hampshire Training Institute on Addictive Disorders. You can access the recording of this webinar in the future at nahatica.org. After completing this webinar, please upload the quiz and evaluation from the Files pod on the left side of this page and email them to nhtiad@myfairpoint.net. Instructions are on the quiz documents as well. You will receive a certificate worth 1 CEU once you have completed and passed the quiz and paid for the webinar. The fee doesn't apply for NAHATICA and NADAC members. Through co-sponsorship with the New Hampshire Training Institute on Addictive Disorders, this one-hour event is pre-approved by the New Hampshire Board of Licensing for Alcohol and Other Drug Use Professionals. If you have any trouble viewing the webinar, audio problems, or have any technical questions, please contact NHTIAD at 603-528-6800. You can also find the phone number on the bottom of the screen throughout the presentation. Please enter any questions that you have regarding the materials that you see today in the chat box on the bottom right hand of the screen. The presenter will answer the questions after the webinar is over and they will be emailed to you. If you are viewing this as an archived event, the chat box option won't be available to you. However, you may email your questions to nhtiad@myfairpoint.net. I hope you enjoy the webinar today, and I'm going to turn you over to Kelly.
Hello everybody, good afternoon, and thanks for sharing your lunchtime with me. Today's webinar is going to be on the core function number 1, screening. So I'm just going to introduce myself quickly. As most of you know, my name is Kelly Reardon, and I am the Associate Professor of Human Service at NHTI in Concord, New Hampshire. Welcome. Now, for people who've done webinars before, having me live tends to be a distraction, so I just wanted to introduce myself and say hello. So now I'm going to go back and just show a nice picture of myself here. All right, let's get started. So the first slide I have here is 12 core functions and the 46 global criteria. This is screening at its biggest. This is it. So number 1 in the core functions is screening. The definition is the process by which the client is determined appropriate and eligible for admission to a particular program. That's the definition for screening. Screening has 5 global criteria. And if you're already lost and confused, please just take a deep breath. I'm going to go through each one of these slide by slide, and we'll break it down nice and easy. But I just wanted you to see at a quick glance what we're talking about today. So the global criteria for screening, number 1, is to evaluate the psychological, social, physiological signs and symptoms of alcohol and other drug use and abuse. The second one is to determine the client's appropriateness for admission or referral. So if you haven't picked up on this yet, you've now heard appropriateness twice in this core function. So that's going to be important. Number 3 in the global criteria is to determine the client's eligibility for admission or referral. Again, eligibility is going to come up again, important to remember as we talk about screening. The 4th global criteria is to identify any coexisting conditions, such as medical, psychiatric, or physical, that indicate the need for additional professional assessment and/or services. And last but not least is to adhere to applicable laws, regulations, and agency policies governing alcohol and other drug abuse services. So let's break this all down. What does it all mean? The short and skinny of it, really, what would happen is a potential client either calls an agency, they might just drop in. Remember, the point of screening is to determine appropriateness and eligibility, but the person seeking your assistance doesn't know this. All they know is they're in crisis, something isn't right, and they need your help. So they'll either call, stop by, and this is the point where you would perform the screening. Once you've performed the screening, you determine, or staff determines, if this potential client is appropriate and eligible, we'll see those words again, for services at the agency utilizing a screening tool. So we'll talk some more about different screening tools and how to determine appropriateness and eligibility. That's the short and skinny. They call, come by, you perform the screening, and you determine if they're appropriate and eligible. So let's talk a little bit about the history of the core functions. Where did these core functions come from? Why are they important? How were they created? Who thought this all up? And really, the core functions were created so there would be a seamless and uniform process for professionals in the substance abuse profession. So they were created to protect the public, and they're created for people to provide competency-based services. So short and skinny is, we decided that we needed to have a process that people, professionals, substance abuse professionals, could use not only throughout the country, but throughout the world. The substance abuse profession definitely needs you. According to the U.S. Department of Labor, substance abuse counseling is one of the fastest growing professions, projected to grow 20% by 2016. So for those of you thinking about getting into the profession, or those of you in the field, this is very important because we're going to be extremely busy coming up with the Affordable Care Act, even though we're very busy now. It's just going to get busier. So the core functions really were designed to sort of be like a recipe. We wanted to have step-by-step criteria that substance abuse professionals could use to make sure we were all giving uniform services. So sort of like, the recipe for apple pie, right? So we wanted to know how many apples, what was the ingredients for the crust, what was the spices. We wanted to know that for counseling in substance abuse. Right here I've put up a map of the current states in the United States that are IC and RC U.S. member states and territories. So currently most of the country are members. Currently Nevada, Montana, Wyoming, South Dakota, Alaska, and Maine are not IC and RC members, along with the Dominican Republic and Puerto Rico. You can find this information on the IC and RC website, which I listed right below the slide. Along with all the IC and RC member jurisdictions in the country, I put up a slide of everyone in the world. So remember, we're talking about global criteria. These are all the countries that are members. And again, you can find this information at the IC and RC website. It's a lot of people doing the same work. It's good stuff. We still have some more countries to get on board, but we're getting there. So a little more about the history. In the early 1970s, formal treatment really started to take hold because some of you may remember, thousands and thousands of people were coming back from war in Vietnam, and they were coming back with very serious addictions, particularly with heroin and opiate. We just weren't equipped for that. When people were coming back home, we didn't have a lot of formal treatment systems in place. So somebody said, you know what, we got to get our act together, and we have to have an understandable process for our counselors to help treat these people with addictions. So in the 1980s, the IC and RC sent out questionnaires to counselors asking what the duties they performed were as counselors. This process is called role delineation studies. And IC and IC set out to find out, how do we create a quality drug and alcohol counselor with quality care, delivering quality care? So from this role delineation study, They developed the criteria that had knowledge, tasks, and skills, and you'll see that again later, of the minimum that people needed to know to work in the profession of substance abuse counseling. So what are these core functions? And short and skinny is the core functions are the day-to-day things that counselors in our profession, substance abuse profession, we need to follow and we need to know. It's the basis, the foundation for how our services are delivered. The global criteria was something that was created to protect the public and provide competency-based services to everyone on the planet. That's a huge undertaking if you really think about it. We weren't just looking in the state of New Hampshire how to have counselors all on the same page while treating substance abuse. We were looking globally. We're looking throughout the world, having everybody on the same page, delivering the same services. So a huge undertaking. Are we there right now? No. But have we made great strides there? Absolutely. So you're kind of sort of part of a club when you get to become licensed and understanding the core functions and the global criteria. Because that means you're part of a club globally if people are in the ICNRC consortium, because they certify some 45,000 counselors worldwide. And we're talking about people in Colombia, Mexico, Spain, Malaysia, England, Greece, Sweden, 47 of the United States and its territories, 5 Native American territories, and all of our armed forces learn, know, are quizzed, and deliver this process uniformly. So there's a big club globally that we all belong to now once we know and learn and are licensed by the core functions. So I put up this saying by Albert Einstein, you never fail until you stop trying. And one of the things, if you've ever performed screening or if you work in a substance abuse agency currently, is sometimes we see individuals seeking help not for the first time, maybe not even for the second time, but maybe we see them coming around for the 5th, 10th, 20th time. But it's really important to remember that no matter how many times an individual comes looking for help, they're never failures until they stop trying to receive the help. It's our jobs and our ethical responsibility to embrace each of these individual attempts towards their recovery as if it's their first time. And that means we offer and show empathy, compassion, care, and professionalism. Screening is the first core function. It is the first interaction that an individual will have with their care in trying to receive treatment. You're the first voice they listen to when they call. You might be the first face they see when they just walk into your agency trying to get help. And whether it's for the first time or the 20th time, we always strive to embrace them with empathy, compassion, care, and professionalism. It's also really important at this point, if people are coming back seeking treatment for the 2nd, 5th, 10th, whatever time, to assess the level of motivation here. You know, what's different now? Why do they seek treatment today? And it's not done with judgment, and it's not asked in a way of, well, why are you in here now? You were here, 2 months ago and it failed. The question is asked because maybe we might be able to ask, what worked well for you before and what didn't work so well for you last time? What could we do different now? What's different about you now, if anything? And why the treatment today, right? If you've been using for, 10 years, why 10 years and 1 day did you decide to seek that treatment? right? That's an important thing to be assessing during the screening process. As I've mentioned, screening is that very first step. It's the first encounter the potential client has with you, your agency, and possibly towards their life. Remember, these clients are not coming in all put together with all the answers, knowing exactly what they need. These clients do not walk in the door and say, yes, I'm addicted to opiates and I know that I need an intensive outpatient program, right? They don't know that. They know that they're scared. They know that things are falling apart maybe around them and that they need some help. And that's all that they know. So if someone's coming to you like that, very important to remember that you're trying to instill some hope with these clients that, yep, it's going to be okay. We're going to figure this out. You offer encouragement and you're able to empathize. The irony sometimes I've seen in my own experience in the substance abuse profession is that if a client calls or comes in for the first time looking for services, the first person that they're usually greeted by is the person who's probably the least experienced, the lowest paid, maybe the newest member on your staff at the front desk, the receptionist. A client's coming in scared, needing assistance, frightened, really confused. They might even be under the influence at that time. And we tend to put our least experienced, lowest paid person at that front desk. Why do we do that, right? And that's usually because, right, we want them to get the training. So we put them in positions where they can really get that experience. But we have to make sure that whoever is that first point of contact for people coming in to do that screening, that they're trained properly and they're trained at understanding how they have to be empathetic, how they have to relay compassion, and they have to be trained to appropriately assess how this client can get the services that they need. As we know, impression is everything. And think about the last time you went somewhere and you were ignored, mistreated, misunderstood, treated badly. You don't want to go there, and you certainly don't want their services. We tend to remember the people that are nice to us, that treat us right. We'll go back to those places again. So it's very, very important that when we look at our agency and we look at who is doing the screening in our facilities, that they're the right people, the people with proper training, and the people that can offer the kind of empathy and compassion that should happen in the screening process. It should happen at all stages of the game, but particularly in screening. You have to learn and know the core functions, the global criteria, bottom line. You have learned other processes in the past. We all learn how to cook our favorite meal, ride a bike, the lyrics to our favorite song. You can do the same thing with this process. It just takes webinars like this and practicing them. Screening's the time for the client and the counselor to meet together and gather information about the client's specific problems and needs. Your agency that you work at will probably already have some type of screening form put together. So it's really important that you know that. You know what the questions are ahead of time. You know where those screening forms are kept, so you're prepared. So when somebody comes in or calls, you don't spend time fumbling around looking for things, but you're ready and you're prepared. Screening should be done to ensure that the client is placed in a setting that will best meet their needs. So everyone that comes to treatment does not have the same problems or personal characteristics, so everyone that needs treatment will not be best suited to be treated in the same way. So everyone that comes through the door, although they might have the one common element of substance use problems, they don't all need the same kind of treatment. They don't need the same, maybe they need a special counselor. Maybe they need a translator. Maybe they need intensive outpatient. Maybe they need residential. Not everyone who walks through the door needs residential treatment. That's a common misconception. So through the screening process, hopefully you're gathering specific information about the individual, their symptoms, and then it'll allow you or whoever's doing the screening to utilize the best resources that you have at your disposal that will be the most effective towards positive treatment. So again, we're going to see some of those words I keep mentioning: eligibility and appropriateness. The core function of screening requires that the counselor or person doing the screening, because we know that's not always a counselor who does the screening at a facility. Whoever is doing that screening, they must be knowledgeable of the signs and symptoms of substance abuse. So I used to say that you'd have to know the DSM-4, but today you need to know the DSM-5. What is the criteria for a substance use disorder? They also need to be knowledgeable about the eligibility requirements for the agency and what makes a potential client appropriate. This person should also be capable of ruling out potential coexisting conditions. So we talked about this just a little earlier in the slides. This person has to be capable of listening to the client, asking the right questions to find out, is there a psychological coexisting condition going on? Is there a physical or medical coexisting condition going on? And what the resources are in the community for that person if that's the case. And lastly, the person doing the screening, they need to be knowledgeable about the laws, particularly confidentiality, regulations, and the agency's policies. Can't stress that enough. So besides the global criteria of what the person doing the screening has to know and be knowledgeable about, they should also be a skillful listener. And that doesn't mean just hearing people. It means actually listening to what a person's saying, remembering that these people are scared, unsure, and need our help. We are the experts. The person doing the screening should also be very versed in keeping necessary records for later use. So being good at documenting what's going on. The ICNRC, and I'm not sure if I mentioned this earlier, but ICNRC stands for International Certification and Reciprocity Consortium. And they define screening, we talked about this already, the process by which a client is determined appropriate and eligible to a particular program. It's a preliminary interview to gather information about a client to determine if admission is appropriate. We've kind of touched on this a little bit already, but the screening interviews, that first interaction that the client has with the treatment facility. So sometimes it might be a good idea, depending on what your role is in your agency, but do a walkthrough. Walk in from the street, walk through the front door where clients would come in, look around at your waiting room. What does it look like? Is it inviting? Is it warm? Does it have empty cups of coffee everywhere, a blasting TV, ripped magazines that are outdated? Is it dark? Is it cold? What does it look like? Because that's what the clients are entering into when they first come. And it's really important that that first interaction, even though they haven't met a person yet, but walking into a facility that's clean, warm, and inviting and friendly, very, very important. And then once they actually meet with a person, it's vital to show that sensitivity, empathy, and interest in helping the client. They're not a bother, right? We've worked in substance abuse agencies. It's busy. That phone is always ringing. Your coworker always needs something. Your boss is calling down because they need to have a meeting with you. Clients that are already in the agency are in need of your attention for whatever reason. I mean, we're multitaskers. We constantly have things going on. But we need to learn that once that, potential client comes to us and says, "Hi, I'm here for help," that we can put all that stuff aside and continue to show the sensitivity and the empathy and interest that we're going to help our client. So there's a system. There's a system to screening. There's a lot of information that's gathered at the screening. So detailed record keeping, crucial. Cannot stress this enough. Most agencies will have some kind of documentation process in place. They'll have a screening form that needs to be filled out. Maybe you have an electronic health record system where a note is kept to detail information about a screening that you performed. So again, know what your agency's policies are on documentation, but always making sure it's clear, it's legible, you're not using acronyms that people don't understand. Make sure it's legible, people can actually read what you're writing, and it's not done in slang, right? We want everybody to be on the same page. Anybody should be able to pick up a screening and take off from where you left off. So now let's kind of break down the global criteria for screening. I mentioned that there were 5 global criteria, and the first one was evaluating psychological, social, and physiological conditions. So psychological is the person you're working with. Are they oriented to time, person, and place? If they're not, that's going to be a strong indicator that they need another level of care besides just a substance abuse agency. Okay, that's giving you some issues that there might be a co-occurring condition going on, and unless your agency is a co-occurring facility, you'll need to make sure you offer the proper level of care to the client. Social, we want to ask these potential clients, do they have any supports, any family, any children, and how have they played into the issues that the client's here to talk about today? Are there physiological signs and symptoms of alcohol and other drug abuse? Are there track marks, odor of alcohol? Okay. Are there any physical issues or concerns that need attention? You need to observe the client to make an assessment of whether or not they're appropriate and eligible. If you haven't gotten the hint yet, appropriate and eligibility are huge parts of screening. The second global criteria, breaking down appropriateness here, is we want to determine, is this patient appropriate for admission or referral? The first thing you want to ask yourself, and this might seem like a no-brainer, does this person have a substance use issue? Okay, people might come in off the street, and I told you they're confused. They have a lot of things going on. Things might be falling apart around them. They don't know what they need. They're not sure what's going on. They might not even know what your agency does. They just know that you help people. And they might come in, and they might not have a substance use issue, but they're struggling with some strong symptoms of depression. So you have to ask yourself, are they appropriate to be in a substance abuse treatment program? No. They need to be in, well, if they just have depression going on, they would need to be maybe to a mental health center, a co-occurring program. But if there's no substance abuse issues, they're not appropriate for a substance abuse treatment program. And the third one is eligibility. Is this potential client eligible for admission or referrals based on the program-specific eligibility criteria? So plain and simple, if you're working at an agency, let's say you work at an agency where it's a transitional living program just for women, and a male client comes in and wants to come in. I mean, it seems like a no-brainer, but remember, that's what we're talking about here in terms of eligibility, right? This potential client might not know that you don't have services for men, and it'll be your job to help give them the referrals to an agency that is appropriate for male. The fourth criteria is identifying coexisting conditions. We talked about medical, psychiatric, or physical. These might create some limitations for them in your program. So you need to indicate a need for additional assessment and/or services. So somebody might come in and they might have some really strong medical problems going on. I don't know, maybe they have, like a tooth abscess or something that really needs some medical attention. You're going to have to assess that and then give them an appropriate referral for medical attention. The fifth global criteria is to adhere to applicable laws, regulations, and program policies governing alcohol and other drug abuse services, utilizing ethical and professional responsibility while understanding and following applicable laws, regulations, and policies. So for people in freestanding substance abuse agencies, you're going to want to follow 42 CFR Part 2 for your confidentiality, but you're also going to want to be looking at your state laws and your agency policies. Okay, so the screen tells me it's time for a poll question. So let me just move over here. I'll read the question for you. Okay, question number 1. The screening process always ends in a person becoming a client in a residential treatment program. And I'm going to give you just a few seconds, and it looks like you were all on top of that one, so that's great. It looks like you all answered false, which is the right answer. The screening process does not always end in a person becoming a client in a residential treatment program. A person could walk in and you might give them a referral to outpatient. You might refer them to an intensive outpatient program. You might refer them to a mental health center. So it's not always a residential treatment program. Great job. Okay. So let's continue on talking a little bit more about how to assess during the screening process a potential client's demographic criteria. And the demographic criteria is the age of the client, their gender, their racial or ethnic background, legal status, veteran status, their income level, their place of residence, and referral source. These are all things that might make a client ineligible for your services or inappropriate for your services. We have to determine is the client's age appropriate for the agency that we're working in. So for example, if a 42-year-old male is trying to get into an adolescent outpatient program, right, that's inappropriate because they need to go to an 18+ placement. Gender, we talked about this already. If the male is trying to seek admittance into an all-female program, it's inappropriate. Racial and ethnic background. Here is where we might want to determine if there's a special need for racial or ethnic specific focus on issues in treatment. So having, the multicultural background, having that understanding, sometimes we might need to employ a translator. Maybe the person who walks through, English is not their first language and they're having trouble understanding or answering your questions. We might need to employ somebody who could help us with that. Legal status. Usually if a client is about to be incarcerated or they're currently incarcerated, they're ineligible for our program. And what could happen potentially is if a client wants to come into treatment and they're appropriate for treatment, but they have a court date coming up, we might ask that the client seek to have it extended, have their court date extended until after their treatment has been completed. Okay. Veteran status. Here's another demographic area that we want to look at, because people who've served in the military, veterans are eligible for services through the Veterans Administration. So if they're seeking services through your agency and it's not the VA, you might want to give a referral to the veteran to the local VA. Income level. So there are some publicly funded programs limit the income clients may have in order to be eligible. So some private facilities will accept only clients with insurance or the ability to pay for services, but there's certainly other agencies that maybe receive some state or federal funding that would allow somebody to come in with little to no income. Sometimes the place of residency is important in program admittance, because some programs only admit clients from specific geographic areas. So some maybe state-funded agencies would only take clients that are residents of the state of New Hampshire, or at least have a certain ratio, like 90% of them have to be from New Hampshire and 10% from surrounding states or the country. And referral sources. There are programs that only accept clients from specific referral sources, maybe the probation office, federal parole, things like that. It's just important to be assessing those, asking about that, and knowing that information. So here are some of the examples. I went through each one by one, giving you examples, but these slides are yours to go back and look at later in the future, but these are just some more examples of appropriate eligibility. There's some complexities of screening that we need to take into consideration also. You know, I talked about how a potential client could either walk in or call. And part of the things that can get in the way of screening or make the screening process a little bit more complex is sometimes these potential clients try to start the screening process maybe while they're intoxicated, right? This is not an uncommon thing for, you know, somebody who might be under the influence of alcohol. They're intoxicated, they're sick of being drunk, they really want to get that help, so they decide to pick up the phone and call your agency. And while they're talking to you, you know that they're intoxicated, can make it very difficult for them to answer questions accurately. Depending on how intoxicated they are, there's the potential that they could pass out while they're talking with you. So that can definitely play into the complexity of performing your screening. They also, if they're not intoxicated, they might be going through a withdrawal process. And withdrawal process can be very painful for people, and they might have a really hard time completing the screening process. They might be able to, you know, get through a few questions, but then they're just too sick and they can't complete the process. So you have to determine what your agency's policy is around that. What do you do at that point? There's motivational factors involved in the complexity of screening. So sometimes people are calling because maybe, you know, maybe the wife came home drunk one too many times and the husband said, you know what, you either get help right now or, you know, I'm taking the kids and I'm leaving. And so the wife calls really sort of under the gun, and the motivational factor is just so she doesn't lose her family. So they might not always be willing to give you all the information that you're asking for in the screening. They just want to get the bare minimum in so that they can make their husband, their wife, boyfriend, girlfriend, whomever happy. And sometimes, you know, the people calling us for help during the screening are not, they're not only just under the influence. Sometimes there's other things going on. There could be co-occurring disorders going on that would be interfering with how they're able to answer the questions in the screening process, or how long they can actually stay present with you in the screening process. So lots of things can be going on for the individual during the screening process time. So very important to take that into consideration. Sometimes, we think that people are going to call during the screening process and be very compliant, go with the flow, right? Because these people want help. That's what we think. And sometimes, when people get intoxicated or maybe they're withdrawing, they can be very angry, irate. How much longer is this process going to take? Why do you want to know that? They can be suspicious of why you're asking such personal questions. So, that can be a factor that you're going to have to deal with while you're working through the screening process. How do you stay calm, continue to show empathy and compassion while a person is, maybe being snippy with you or angry or yelling at you? So a lot of things to manage during that screening process potentially come up. I put some sample screening forms on the slides for you, and I tried to put some pretty common ones, things that you'll be able to see. This is a very, very basic screening form, and it's called the CAGE. And if you notice throughout the 4 questions, I've italicized and underlined, it should be cut down, annoyed, guilty, and eye-opener. That's what CAGE stands for. And you want to be asking, have you ever felt you should cut down on your drinking? Yes or no? Very basic, simple, right? This should only take seconds probably to complete this. Second question, have people annoyed you by criticizing your drinking? Third question, have you ever felt bad or guilty about your drinking? And have you ever had a drink first thing in the morning to steady your nerves or get rid of a hangover? And we call that an eye-opener. So obviously, the more positive responses you get, the more that there could be an issue going on. I've listed some agency screening forms. These are sort of snippets from different agencies that I've worked at, so different screening forms. This one is actually from the Prevention Think Tank Incorporated. This was an agency screening form, and you'll see up at the top it says Chapter 1 Screening. So this was something they thought was a good sample of an agency screening form, and you'll see at the top it just really asks for our client data, the basic simple things, and then it gets into the current problems. And it asks about physical problems, family problems, legal problems. What's the problem substance? What's the frequency of the use and the age of the first use? So very, very basic and simple. Is it the best form to use? Not necessarily, but I'm just trying to show you some samples of things that you might see either in the agencies that you work at or agencies you will work at. And then it asks on this particular one what their CAGE score is. So remember the slide previously, how did they do? Out of those 4 questions, how many of them were in the positive response? Okay? And then at the very end of the form, it has the outcome. Are they appropriate for the program? What would be an anticipated admission date? And if they're not eligible, why? And where do you refer them? And then it simply just has the logistics of the date of the screening, date of the referral, and referral follow-up. So, this is as basic and simple as it gets. Screening should not be a long process for several reasons. Right? So we've talked about some of the complexities already, things that could occur during the screening process. People might be under the influence, might be withdrawing, might be going through some psychotic experiences at the time. So you're not going to get a long time with people on the phone, right? You have to determine appropriateness and eligibility fairly quickly. So there's a real skill to doing this. So this is one example of a screening form. Let's see if I think I have a couple more. Here's another one that gets a little bit more detailed. Okay, so you'll see some of the similarities again up at the top are sort of the demographics. Who are they? What's their age? This one asks if the person is pregnant. Okay, because some agencies might have criteria that if a person calls and has a substance use disorder and they're pregnant, that they would be considered a top priority. They would go to the top of the list for admission, right? The substance abuse history is a little bit more detailed. We're asking for the drug of abuse, age of first use, same thing as the other form. We're also asking about route of administration, So this refers to the drug that the individual is abusing. Are they doing it intravenously, intranasally, orally? So how are they consuming this drug of abuse? And then we're asking about amount last used and when, and recent use or patterns of this use. Why would we ask about route of administration? So the kind of short and simple explanation would be that people who use maybe intravenously, it could be a public health risk, right? There's concern about hepatitis, HIV, so something that we definitely would want to look at. This particular form goes on to ask about medical history. So if you look at the conditions, it's asking about blackouts, sweats, fever, nausea, vomiting, diarrhea, right? Pretty nasty things here. But what are they looking for, right? They're looking for things. First, they could be looking for withdrawal symptoms, which would indicate substance use disorder. But they're also looking at some pretty significant medical conditions that maybe this agency would not be able to treat. They would have to refer out for some of these things, such as seizures, maybe, eating disorders, cirrhosis, right? Any type of head injury. We'd want to ask, if that's happened, were you treated for this? And what's the current treatment for this medical condition? This particular form goes on to ask about medications. So, again, it's another form. There's nothing wrong with it. But again, try and picture, a client who's maybe highly intoxicated trying to come up with their medication name, who prescribed it, what the dose is, disclosing serious medical conditions. I mean, we're asking these people to come up with a lot of information. So, it's all important information. We definitely need it. Does it help us with appropriateness and eligibility? Possibly. All things to consider. This one is a continuation of the form that you just saw, and it goes on to ask about psychological history. So again, very important, asking about whether the person you're screening has ever had suicidal thoughts, plans, attempts. You want to get very specific. You want to know how, when, where, when was the last one. And legal history. It goes to ask about assault charges, sexual assault charges, arson, or violence. So for me, this screening form is definitely for residential because those are serious charges that somebody in residential, you're going to want to think about the safety of the other people, the other residents in the facility. And they also are asking the current legal involvement. So are there pending charges or open court cases? Because if the answer is yes, maybe we want to refer the person to get court dates pushed back so they can get treatment. And the last question is that assessing the motivation. What precipitated your call to us today? So why today? Here's some screening tools that are definitely effective, that are used in substance abuse treatment agencies today. The Addiction Severity Index, a little bit longer. Compared to the CAGE, a lot longer. Probably takes a good 45 minutes to complete the Addiction Severity Index, but it gets a lot of information. CAGE, as you saw earlier, very simple, very easy. The MAST and the DAST are about 20 questions apiece, yes or no's. Pretty quick to get through, probably only maybe a minute or two. And the audit, which stands for Alcohol Use Disorders Identification Test, again, very brief, shouldn't take more than maybe a minute or two. So if you haven't heard it enough, you're going to hear it again. Appropriateness. And here we are assessing severity of substance use, physical conditions and health of the client, psychological functioning, and any previous treatment that they might have already had. So severity of substance use, here's where we're going to want to be looking. Does the agency you're currently working at, or the agency the client's trying to get into, do they have the necessary expertise, the staff, and the physical plant to provide the appropriate level of care? So the screening staff or counselor, they carry, a serious responsibility when determining the eligibility of the client for the program. They need to determine if the agency has the appropriate level of care for the degree of seriousness of the substance use problem. They need to be able to evaluate the capacity of the facility to handle any physical problems the client might have. And then they also need to be able to identify if there's any co-occurring mental illness that needs to be addressed before or during the treatment of the substance use issues. Just looking at that paragraph alone, it's a lot of work. It's a lot of responsibility. And it all has to happen fairly quickly. And it all has to happen while other things are going on in your agency. So you can see how important the process of screening is, and also what a responsibility the person who's doing the screening, how much responsibility they carry. Physical conditions and health, this is pretty obvious, but is there a need to support any special health needs, such as pregnancies, seizure disorders, heart conditions? Does your program have resources to manage this, or do they have easy access to maybe a medical healthcare clinic, hospital, whatever might be close by or easy access to? So you have to ask yourself, do we? And if we don't, what might be a better appropriate referral for the potential client? Again, fairly obvious, the psychological functioning. Is there a co-occurring disorder? Is there need for specific supportive treatment? So while they're in your facility, maybe they're in an intensive outpatient program for their substance use disorder, but they also need to be going to the mental health center across the street for individual counseling for an anxiety disorder. Previous treatment. Has the client been previously successful with a particular modality or treatment model? So if they've been in treatment before, you're going to want to be asking them, what was good about that treatment? What worked for you in that treatment model? And you're also going to want to ask, what wasn't helpful? Because that's going to be a big indicator of, is that something you're going to want to provide to this client? You're going to want to try and role model again the things that did work for this client, and maybe steer clear of the things that didn't work so well for that client, if you can, if that's possible. Making sure you're always adhering to the law. Sometimes I think these things are so obvious, but I can't stress it enough. You have to show you're an ethical and responsible professional, and you do that by adhering to your state, federal, and agency law rules and regulations. So I listed some of the confidentiality, 42 CFR Part 2, HIPAA, the American Disabilities Act, and any agency policies in place. So know your agency policies as well as state and federal law. So here's the part that I'm not going to spend a lot of time with this, but it's something that I really feel that this webinar needs to address when we're talking about core functions, and that is tab 21. So the 12 core functions were designed, implemented, put in place, and they work congruently with the addiction counseling competencies, the knowledge, skills, and attitudes listed in tab 21. So I'm going to go through a couple of these just so you have the information, but I'm not going to go slide by slide because I think there's 9 different competencies. So I won't bore you all to pieces here, but so do yourselves a favor and go onto the SAMHSA website and either download electronically or order the tab 21 book. TAP stands for Technical Assistance Publication. 21 is just the number of the addiction counseling competencies, but these are going to line up with the 12 core functions. So under tab 21, the core function of screening and assessment falls under the practice dimension of clinical evaluation. So when you're looking at the 12 core functions, number 1 is screening. And if you look at the practice dimensions under tab 21, if you look under number 1, it's clinical evaluation, and screening and assessment would go under there. So that's the congruency piece right there. 12 core functions on the left-hand side. Picture actually 2 different books because that's what you're looking at. But when you read the material together, they weave in and work congruently. So let's take a look. Let's do a poll question first. Okay. So let's see. Let's see if I can get this to operate again here. You already answered that one, so let me go here. Okay, so poll question number 2. The screening staff person needs to be knowledgeable of the signs and symptoms of substance abuse, true or false? Wow, you guys are awesome. You already answered it. I didn't even have to give you any time. Yes, that is correct. The answer is true. And the reason a person needs to be knowledgeable of the signs and symptoms of substance abuse is because hopefully you're all saying in your heads it's criteria around eligibility and appropriateness. Great job. Okay. Now, back to this. Okay. So now I'm just going to go through an example. So in tab 21, section 1 is clinical evaluation. And like I said, under clinical evaluation is screening and assessment. Forget about assessment for now and let's just look at screening. So screening under clinical evaluation, tab 21 says it's the process through which counselor, client, and available significant others determine the most appropriate, there's that word again, initial course of action given the client's needs and characteristics and the available resources within the community. So you're seeing some of the same language. It's saying some of the same things. Nothing different. What it does do is it gives you a definition under screening. The object is to establish rapport, including management of crisis situation and determination of need for additional professional assistance. And they break it down under knowledge, skills, and attitudes. I'm not going to read through each one. Like I said, you guys can definitely go back, take a look at these slides. But I just wanted to mention it as a tool in understanding screening. You can order it through SAMHSA for free or just download it to your computer. So it goes through the whole thing. I'm going to skip right through those. And the last thing I want to talk about once I get there on this is I should be there pretty soon here. Tasks of the initial interview. So I've mentioned this before, but I think it deserves mentioning again as I wrap up. You need to be able to demonstrate that you can develop rapport with the potential client. You have to build trust. You're asking extremely personal questions. You're trying to build trust that this person can confide in you and give personal information, and it's for their own good. You're going to, have confidence with this information, and you're going to hold it confidential. You'll have appropriate screening forms assembled and complete. I talked about this earlier. Don't be fumbling around, right? It's going to make the client seem like, man, this agency doesn't know what's going on. You want to collect and review any referral information. If a client's coming from another agency, they can send over some paperwork that might help you determine the appropriateness and eligibility. You want to determine if the individual has a substance use disorder. You want to determine if there's a co-occurring illness. Does this client meet the admission criteria? And if they are eligible, to put them in the appropriate level of care. So this just goes through how to establish rapport, having cultural considerations, maintaining eye contact, having open, inviting, square body language, choosing your words carefully, asking open-ended questions, affirming the client, be validating, genuine compliments. Clients read right through you. If you're being phony, they're going to know it. Just because they're in need of help does not mean they're stupid. So, and then kind of making summary statements just to let them know you're listening, you're there, they haven't just been talking to a wall. That wraps up. Sorry for taking a little over an hour here. I've listed some references at the last slide here, so feel free to look up any of this information. And I thank you for spending your time with me today on your lunch hour. Hope this was helpful. Thanks, everybody. Bye.